Okay, so we're looking at a class of penicillins that's like examples of penicillins that actually fall under the class that is known as broad spectrum. Now, broad spectrum is literal, Guys, on this broad is acting on many things. So many the first penicillins, they were not really acting on so many organisms, right? So scientists actually went back to the lab and tried to create better versions of penicillins that we can actually use and treat infections more. So for the broad spectrum penicillins, it's just to list them. All right, so just a definition, we say that they are a subclass of beta-lactamase antibiotics. They are effective against both gram-positive and gram-negative bacteria. You understand? These ones, they can act on the both. So they are commonly used for treating respiratory tract infections, urinary tract infections, gastrointestinal infections. Now, types of broad-spectrum penicillins include the Aminopenicillins. So drugs like Ampicillin. This is the first picture, Ampicillin. That one is used for treating meningitis, endocarditis, respiratory infections. Then we have the Amoxicillin. All right, let me check it here. Yeah, this is Amoxicillin. So it's commonly prescribed for treating ear infections like otitis media, nose infections like sinusitis, then pneumonia. Then we have the co-amoxiclav. That one, they are combining amoxicillin plus clavulanic acid. Right? Then we have the extended spectrum penicillins like Ticarcillin, is effective against Pseudomonas aeruginosa. Piperacillin, usually combined with tazobactam. Then we have the meslocillin. That is basically for intra-abdominal gynecological infections. Mechanism of action of penicillins is they inhibit bacterial cell wall formation. Maybe the bacterial cell wall could be formed but not properly, you understand. So they prevent a cross-linking or interaction of peptidoglycans, So this will not lead to cell death, right? So penicillins normally they are like, how do I put it? They are resisted, you understand. So if you want to enhance if you want to make them overcome that resistance, you basically combine them with beta-lactamase inhibitors. So beta-lactamase inhibitors will fight the enzyme while the penicillin basically fights the infection. Alright. So different types of infections which you can use penicillins for include respiratory tract infections, urinary tract infections, skin and soft tissue infections, gastrointestinal infections like Helicobacter pylori, then sepsis and meningitis. Considerations is you always use the ones that are combined with beta-lactamase inhibitors, just to resist just to overcome the resistance rather. So they have some adverse effects like nausea, diarrhea, allergic reactions. Sometimes they can disrupt the gut microbiota and basically make you prone to developing infections like the Clostridium difficile infections. So combination therapy, so it's often paired with beta-lactamase inhibitors, right? Just like we said, just to overcome the resistance.